Health aired on Equinoxe Radio, a multimedia, and for presentation, I am Monsieur Lucy Liengu. In recent months, Cameroon has recorded an alarming increase in the number of food poisoning cases across the national territory, leading to serious health complications and in some tragic cases like death. This surge is not only poses a significant threat to public health, but also highlights the urgent need for awareness, prevention, and effective response strategies. In this edition of your health program, we're looking at what food poisoning is all about and ways to mitigate the effects of food poisoning. With me here in the studio is our guest. Before I introduce our guest for the day, I have the honor to introduce my co-host. Good afternoon, Immaculate.
Good afternoon to you, Lucy. Good afternoon, dear doctor. Good afternoon to our millions of televiewers and listeners. It's a pleasure always being here.
Of course, it's always a pleasure. And without any waste of time, our guest is already present. Good day, Dr. Glory BEFEKE ANYE. You are a general practitioner. Good afternoon and welcome to our health program.
Good afternoon, Lucy, and thank you for the invitation.
It's always a pleasure having you in the studio to discuss health-related issues. And without any waste of time, we would like to know, to a layman's understanding, what is food poisoning all about and what are the common causes?
Food poisoning, in short, is a disease that is caused by consuming contaminated food or contaminated beverages. And the causes of this vary. We could have a bacteria poisoning, bacteria like salmonella, for those who understand medically. We equally have viruses. There are some viruses like hepatitis A. They are found in food. Most times it's gotten whilst traveling, buy food on the way and all of that. We equally have parasites like Giardia. Giardia is a kind of parasite that can cause diarrhea, excessive diarrhea. Equally, some chemical substances. We equally have toxins like Staphylococcus aureus and many others.
All right, and how can we tell if food has gone bad or is likely to cause food poisoning?
If you start getting any unpleasant odor, like a kind of sour smell, that already should be a red flag for food poisoning. Equally, change in the texture of the food, maybe like slimy nature of the food, that equally should be a signal of food poisoning. The taste, change in the taste, and equally the color. Sometimes you find mold or discoloration of the food. That equally should be a red flag. Also, the expiration date. In all food items, always try to check those dates that are written on, like best or on before, in order to avoid consuming those that the dates are already past.
For those who would like to participate on today's edition of the program, the numbers are 670-5470-49. I repeat, 670-5470-49 or 656-622222, 656-622222. And whenever you want to call, make sure your receiver is turned off. If not, we'll not be able to get you clearly. Back to you, Dr. Glory. We want to know, how does food poisoning manifest in humans and how long can it last?
Right. It varies depending on the pathologic agent that is implicated. It can start by, some of the symptoms can be nausea or vomiting, and equally one may manifest with abdominal cramps, fever, diarrhea. So it can take some few hours and can last for some few days before its manifestation.
While introducing us on food poisoning, you talked about beverages and other items. Are there some specific foods that are, like, let's say, associated directly with food poisoning, or
yes,
all foods do manifest, can lead to food poisoning?
There are some particular food items, like raw food items, or undercooked meat, or poultry, or seafood that are not properly cooked. We should avoid such. Equally, eggs. Eggs, they have those poisoning aspects once they are not properly managed. Dairy products as well. It's true, some individuals have a kind of immune system where they are not tolerant to some dairy products. So overconsumption of such dairy products can lead to maybe diarrhea or some food poisoning. So some of these food items listed should actually be taken note of. Equally, fruits and vegetables that are not washed equally can lead to food poisoning.
Now, within this group of persons, we have elderly, we have children, we have pregnant women. Who is more exposed to food poisoning?
Right, all these category of persons you've mentioned are at high risk. Like the elderly, they are at high risk because their immune system starts getting weakened with age. Pregnant women, hormonal factors, hormonal changes will affect their immunity, their immune system. So they are equally high risk or prone to food poisoning. For children, their immune system is still developing. So such equally are vulnerable to food poisoning. Some chronic illnesses as well. There's some people with chronic diseases like diabetes, liver diseases. They are equally prone because of that weakened immune response to their system.
All right, but doctor, recently across the national territory had some cases recorded wherein some people suspected that maybe because some products that were kept beside what we eat, like say beside our pot, beside our goods in the house, let's foodstuffs to be precise, that maybe would have led to the cases that we had across the national territory of children dying, be it in Bafusam, in the East region, to mention a few. Can we also see that our environment can also lead to food poisoning?
For sure. That's why hygiene, poor hygiene is one of such factors. So we emphasize on washing, especially the food items we want to eat, like fruits and vegetables. If we should eat fruits, should be washed. And the food that we want to prepare should be well cooked, because undercooked food or raw food can expose one to food poisoning because of the environment, the poor hygienic nature that we find ourselves sometimes in.
In case someone discovers, I think we have a call on the line. Do we have a call on the line? Okay. In case someone notices that he or she is suffering from food poisoning, what's the next step to take?
Right. Since basically it's through ingestion, it's through some chemical substances equally, like heavy metals can cause food poisoning, but basically it's through ingestion of these food items. So one needs to keep him or herself hydrated. So drink a lot of water, and equally should rest, to enable the body equally to rest in order to recover. And in the event where there is persistence, maybe of vomiting, fever, or tiredness, the one should go to seek medical advice at the hospital.
But immediately, what should be done if I notice that maybe my sister is experiencing a case of food poisoning? What can I do immediately as first hand in order to save her life at home?
First hand, you enable that she should drink a lot of water, depending on the degree or the severity of the manifestation of the symptom. If you realize that the one is vomiting profusely or having diarrhea or abdominal cramps, if painkillers or anti-diarrhea cannot help, like over-the-counter drugs, that one should be rushed to the hospital immediately. But the first thing is the hydration you enable. But if you're giving and the one is vomiting persistently, is hospital.
Also, doctor, you have some people who have the meat. I don't know if it's the meat that will say red oil also works. I don't know if it's traditional or is also advised medically.
Right. This, well, medically, it's true that sometimes the red palm oil can help with situations like that. If you, the bottom line is, if you try this and it doesn't go, for instance, if the individual keeps vomiting, you ingest or you lick the oil, but you reject, you keep on, you reject, the best thing is to rush to the hospital, because if your cells get dehydrated, it's death. So if you try some of these possible first aid, home-based treatment and or management, and it's not successful, I think that you should rush to the hospital.
Apart from hepatitis, what other health condition can increase the risk of food poisoning?
Yes, we have. We mentioned diabetes. Diabetes as a result of the weakened immune system. We equally think of liver disease, because liver disease can lead one to a kind of vulnerability to infection. We can equally have HIV/AIDS due to their weakened immune system.
For those who are watching us, then know this is the right time for you to call and ask your questions as far as food poisoning is concerned. Here are the numbers once more: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222.
And now, Doctor, I would like to understand, in our country, in Cameroon, do we have measures, or say, is our healthcare system enough to take care of those who are victims of food poisoning, like urgency?
Right. The recent case we had at New Bell, we saw how the medical team was mobilized to handle such events that we had at the time. Our medical system, I think, may not be.
We have a call on the line. We'll come back to that question as soon as possible. Hello, good afternoon.
Good afternoon.
Your name? Okay, go ahead.
Yeah, I'm asking about of food poisoning. Is the stool of food poisoning contagious?
We didn't get your question, sir, please.
He's asking us.
I want to know if the stool of a food poisoning patient is contagious or not.
Okay.
Thank you for your question.
Contamination is trying to talk about whether some. Yeah, you've got the question.
Right. The stool, be it of a healthy individual, be it of one who is sick, stool in the first place is not healthy for the next person. So that again leads to poor hygiene. So I think a stool from any source should be avoided as much as possible.
And we're talking about Ima.
Okay.
We're coming back to our health system, right?
Yes. So our health system, we may not be the best, but when it happens, we see the way the health personnel, they get mobilized, and we put in our best, especially with the recent incidents that we had. We saw how the hospital at New Bell and Lekansini, the doctors, the nurses, everyone was on alert, the ambulances, and I think that the Minister of Public Health really managed the situation very well. Otherwise, many children would have lost their lives.
Doctor, we have noticed that cases of food poisoning are very rampant in Cameroon. As you rightly mentioned, the case of New Bell, which was very recent. We have had other cases, and there was a case in Limbe where 2 children died of food poisoning after eating noodles, commonly known as Indomie. We had another case in Bafoussam where children of the same family, about 3 of them, died after eating fufu corn and huckleberry, the same food that was eaten by other members of the family, but these 3 died. That means they ate the food the next day when it was heated by the mom. Why are cases of food poisoning so rampant? What's happening in Cameroon now?
I think that to justify and to analyze the situation properly, we need to take individual cases and study and really make some proper inquiries. For instance, the case you talk about that happened where some family members ate the same meal and children were affected over the others. You know, the age group, if we should come on the age group for children, their immune systems are still developing, and I will not be able to give precisely the ages of these children. So probably these meals were not maybe they were not properly conserved in the refrigerators, because sometimes you don't equally conserve them properly, especially perishable, and you conserve them in the refrigerator. After a while, it invites those bacteria, invites the viruses that can lead to that. And given that they are children, their immune system is still developing, they may end up being affected over against maybe the other adults who were there. So I think it's about analyzing each situation properly. But in all, we talk about hygiene. Check your food properly, the expiration dates, washing of your surfaces, taking care of the meals that we prepare, and be watchful of the color change. If you see mold, sometimes equally, Lucy, Immaculate, well, poverty, if I should come, poverty.
True.
Exactly.
You see a pot of corn fufu that has been prepared, the mother want to manage, or the household want to manage, and so this corn fufu have to eat it for 3 days, and maybe there's no refrigerator. Irrespective of the texture change, the color change, maybe mold, there's already mold on it, and it will be taken for granted. They may scrape the mold off and say no. So there's lots and lots of factors that can contribute to food poisoning in our society, especially poverty.
Thank you.
And any last words, Doctor, before we put an end to this program?
Yes. So we encourage the population to keep clean, maintain a good hygiene on the food. If you go to the markets to buy, make sure you check your items, the expiration dates on all your items. And back home, make sure you wash the surfaces. Don't use the same maybe chopping board to chop raw meat, and use the same chopping board to chop fresh vegetables. We can have a cross-contamination. And preserve our food properly and in time in the refrigerator, so that we can avoid all of these food poisoning.
Thank you very much, Dr. Glory BEFEKE ANYE, for honoring our invitation today.
Thank you, Lucy.
Hope to have you again next time, yeah? All right, thank you, dear viewers, and also thank you, Immaculate Fogri.
It's always a pleasure, Lucy.
And we have come to the end of this edition of your program, You and Your Head, aired on Equinoxe Radio, a multimedia. For presentation, I am Lucy Liengu. At the technical dashboard, we had Jonathan Babiola and Louis Pego. Stay in the company of interesting programs shown on Equinoxe Radio and television.
Bye-bye for now.